Imagine you're an ER doctor and you have an elderly woman who's really confused, she hasn't been taking care of herself, and she's trying to leave the ER. You tell her that you're really worried about her and that she needs to stay, but she refuses and she's getting prepared to leave. What would you do in that situation? Would you strap her down and restrain her, or would you do something else? Well, this is a real situation that I was in a few nights ago. I had a 75-year-old woman that was brought to the ER by her family because they were concerned that she was getting more confused over the last month, and she would often go missing in the evenings because she would wander around in the neighborhood and get lost. She was becoming increasingly forgetful and would leave the stove on, and she was clearly not taking care of herself. So you've done a medical workup that included a CT scan of her brain, and all of your tests are normal. The woman seems quite confused when you're talking to her, and she isn't able to comprehend why she's in the ER or what the family's concerns are, despite explaining this to her multiple times. And when you tell her that she needs to stay for observation and management, she gets really upset and says that she's leaving the hospital and that you can't keep her there against her will. So she's trying to lower the guardrails of the bed, but she's unable to, and so she starts to posture as if she's going to climb up over the guardrails of the bed to try to escape. What would you do if you were in my shoes? Would you A, let her leave and tell her to follow up with her family doctor? B, call security to strap her down to the bed? C, inject her with medications to sedate her? Or D, do something else? Let me know what you would have done in the comments below, and I'll share my own thoughts on what I actually did in that situation in a post tomorrow.